There are 2 locally acquired coronavirus cases to report today and 4 new cases from hotel quarantining. The 2 new local cases are both children and have no community exposure sites during their infectious period. One is a contact of the positive case that we reported last week linked to the Reservoir household, and one is a contact of the City of Melbourne case that we announced over the weekend. We expect to see more known about the close contacts positives as they more widely move their way through the day 13 quarantine clearance. What these figures tell us, continue to give us confidence, is that the system is working and that the public health settings that we have in place at the moment are appropriate. And what I want to do is thank all of those people, particularly those primary close contacts, for doing the right thing as increasing numbers of them come to the end of their quarantining period. And we do, of course, continue to offer support to those people as they make their way through that important work. As of yesterday, the Department of Health still identified some approximately 2,000 active primary close contacts linked to the outbreaks. More have been cleared, but more linked to the recent cases and exposure sites have been added. But overall, the net direction is in a downward trajectory for those primary close contacts. Of those, the main branches continue to be the city. There's more than 300 linked to the City of Whittlesea branch of the Kappa outbreak, more than 700 still linked to the Port Melbourne branch, 300 to the R-Care branch, and some 400 to the West Melbourne Delta variant branch. Over 6,000 other primary close contacts have been cleared, which is a good thing. Since the start of this particular outbreak, we have also had more than 100,000 calls and messages being sent to those cases and close contacts, and more than 10,000 houses have been visited by the Household Engagement Program. And I want to thank the Australian Defence Forces for their support as part of that program. Contact tracing teams have continued to work, as we indicated yesterday, on the notional links that have been built between the case that we announced on Saturday, that is the one residing within the City of Melbourne. That positive case lives in the same low-rise townhouse complex as the positive case worker linked to the R-Care Maidstone outbreak. And there was reason to believe, both from the genomic sequencing and from the epidemiology and investigations into that precinct, to point to possible exposure sites around a small number of internal facilities, and both discussions with those people and the genomic sequencing has confirmed those links. So yesterday, on the basis of that, the Department of Health contacted residents of this complex to inform them of that potential transmission risk and has asked them to isolate. Department of Health specialist nurses were on site this morning working with the residents, and a pop-up testing facility was established near the facility to make sure that we could make it as easy as possible for people to get immediate testing. Most residents will simply be required to test and isolate until negative. That is the Tier 2 contact process. But a smaller number, based on the epidemiological work that's been done to date, will probably be more likely to be Tier 1 exposures, subject to the conversations and testing that's going on at the moment, and will most likely have to isolate for 14 days but that work is active as we speak. Investigations are also underway as to the ongoing source of the Reservoir family of 4 last week, looking upstream to some of those exposure sites, which now, of course, date back some number of weeks. With no clear contact tracing yet established as to the precise locations for that, what I'll use this as an opportunity is just to point to the fact that our contact tracers are looking at a number of cases that have been in or around the Thomastown industrial precinct just south of the Metropolitan Ring Road. There are as many as 10 public and private exposure sites within this particular pocket of Thomastown, with some broad overlap between a number of the positive cases. Nothing particularly definite, but as we seek to run down the last few chains of transmission, we want to use this as an opportunity to remind everyone who works in that industrial precinct, whether you deliver goods there, whether you are part of the service delivery to that particular industrial precinct, just to think about any symptoms that you may have had over the last few weeks and to get tested if you have, and to get tested more broadly if you show any signs of being unwell, and just make sure that you help running down the last few chains of this particular outbreak. Again, I stress this is not an exposure site as such. It's just a reminder to all of us to get tested if you have any symptoms. What we've seen over and over again in these outbreaks is that the critical lines of inquiry are there when we can make sure that people are doing the right thing as soon as they possibly can when it comes to any symptoms and exposures. The reality is that we need the confidence that broad testing numbers have and targeted testing into specific areas have to make sure that we capture all of the surrounds of these outbreaks and run down their various branches. So that's why the 16,932 tests that we recorded yesterday were very welcome, but we still would like to see increased numbers if you are reflecting even the slightest of symptoms, particularly at the moment. Getting tested and getting tested quickly in the some 200 sites right around the state, which have very minimal waiting times at the moment and can guarantee you a quick turnaround time, is the most important thing we can all do to make sure that our community, our contact tracing team and our public health officials have the intelligence and the up-to-date information on the movement of the virus as we come, we hope, towards the end of this outbreak. We want to make sure that we get a head start on the virus. We want to make sure that we stay ahead of it and that we run down those last few chains of transmission. Just on vaccines, yesterday in the state-run sites, on a Sunday of a long weekend, we delivered 13,764 vaccines through the state's facilities, bringing a total to almost 800,000 through the state system. As we announced, I think over the weekend, the work of these centres will now focus on clearing the second dose administration for those tens of thousands of people who came forward over the last 3 weeks once we opened up, particularly the Pfizer vaccinations to the 40 to 49-year-old group. The 50,000 first dose bookings that are already in the system will of course go ahead as planned. And in regards to just the wider issue of vaccinations, as we get into a increasingly consistent higher rhythm, it's really important that when it comes to the Pfizer, that is the 40 to 49-year-old group, that people now book through the coronavirus hotline into the system to make sure that we have a a measured and planned system both for first and second doses as we seek to maintain the highest possible level of effective and efficient delivery of the Commonwealth vaccination program.